You've probably heard all about GLP-1 drugs. They're everywhere, hailed as game changers for weight loss and diabetes. But today, we're going to zoom in on a very specific high-risk group that doesn't get as much attention, patients with acute kidney disease. So what does the data actually say about them? So, are these medications the miracle cure they're made out to be? Well, they offer some truly incredible benefits, no doubt. But what about the trade-offs, especially for some of the most vulnerable patients out there? Let's dig into what a massive real-world study has uncovered. Okay, so let's get right to it. Just look at the trend over the last decade. Prescriptions for these drugs among patients with acute kidney disease, that's a sudden, serious loss of kidney function, have absolutely surged. I mean, back in 2012, it was practically zero, a tiny 0.04%. Fast forward 10 years, and it's over 1%. That's a huge shift in clinical practice. And if you think that's a big jump, check this out. For the highest risk group, we're talking patients dealing with both acute kidney disease and type 2 diabetes. That prescription rate just skyrockets to over 6%. It really shows you just how much doctors are now relying on these drugs for their most complex cases. But here is the major catch. For this specific group of patients, taking GLP-1s came with a 5.4 times, let that sink in, 5.4 times higher risk of hypoglycemia. That's dangerously low blood sugar, an absolutely massive increase that we have to pay attention to. And you know what? The risks don't stop there, not by a long shot. Users were more than twice as likely to experience depression and gastroparesis, which is a scary condition where the stomach essentially becomes paralyzed. That was also more than twice as likely. A rapid heart rate? Yep, double the risk there too. A clear and pretty concerning pattern of side effects starts to emerge when you look at the data. But this is where the story gets really interesting, because the risk profile isn't just a simple list of bad news. It's actually evolving. For instance, there's some good news. Over the past decade, reports of nausea and vomiting, two of the most common and talked about side effects, have actually gone down significantly. But at the exact same time, reports of a different problem, constipation, have shot up. So it's not that the side effects are just getting better or worse overall, they're shifting. The challenges these patients and their doctors face are literally changing over time. So, what's the bottom line here? What have we learned? Well, first, the use of GLP-1 drugs is climbing, and it's climbing fast in this specific patient group. Second, there are significant side effects to consider, especially that huge risk of hypoglycemia. And third, and this might be the most crucial point, the risk profile isn't set in stone. It's a moving target, which makes this a really complex balancing act for everyone involved. And this all brings us to the big overarching question. These drugs really do represent incredible progress in medicine. But as their use expands into more complex and vulnerable populations, the real challenge becomes this. How do we harness all of their amazing power while, at the same time, making sure we are vigilantly protecting patient safety?